Fungal infections in aquarium fish are a common yet often misunderstood issue that can affect both novice and experienced aquarists. These infections are typically caused by opportunistic fungi such as Saprolegnia and Aquarium, which are present in most aquatic environments but only become problematic under certain conditions. Understanding how these fungi operate, recognizing the symptoms early, and implementing appropriate preventive and treatment strategies can make the difference between a healthy aquarium and one plagued by disease. Fungi in aquariums tend to infect fish when their immune systems are compromised or when their skin, fins, or gills are damaged. These microorganisms usually colonize dead organic material in the tank, but when fish are stressed, injured, or already battling another illness, they become vulnerable to fungal invasions. The most recognizable symptom of a fungal infection is the appearance of white, cotton-like growths on the skin, fins, mouth, or gills of the fish. These growths can vary in size and density and may be accompanied by other symptoms such as lethargy, loss of appetite, erratic swimming, or fin rot. Sometimes, fungal infections are secondary to bacterial or parasitic infections, making diagnosis and treatment more complex. Stress is a major contributor to fungal outbreaks. Fish subjected to poor water conditions, temperature fluctuations, overpopulation, aggressive tank mates, or frequent handling are more likely to fall victim to these opportunistic pathogens. Stress weakens the fish's natural defenses, opening the door for infections. Maintaining consistent water quality is critical. High levels of ammonia or nitrite, low oxygen content, and imbalanced pH can all contribute to fungal growth. Regular testing and maintenance of water parameters, along with appropriate filtration and aeration, are essential in reducing the risk of fungal issues. Quarantine procedures also play a vital role in preventing fungal infections. New fish should be isolated for at least 2 weeks before being introduced to a community tank. This period allows for observation and treatment if any signs of disease emerge. Similarly, any equipment, decorations, or plants introduced into the aquarium should be thoroughly cleaned and, if necessary, disinfected to avoid introducing pathogens. Injuries are another key factor in fungal outbreaks. Fish with torn fins, bite marks, or scrapes are at a higher risk of developing fungal infections, particularly if they occur in unsanitary conditions. Preventing injuries involves choosing compatible tank mates, avoiding overcrowding, and ensuring the aquarium setup does not include sharp or abrasive decorations. Nutrition also plays a significant role in preventing fungal infections. A balanced diet that includes essential vitamins and minerals strengthens a fish's immune system, making them more resilient against pathogens. Providing species-appropriate food in the right quantity and variety can improve overall health and reduce the likelihood of infections. When an infection is detected, prompt treatment is critical. Several antifungal medications are available in liquid or powder form that can be added to the aquarium water. Common active ingredients include malachite green, methylene blue, and formalin. These substances are effective against many fungal strains but must be used according to dosage instructions to avoid harming the fish or beneficial bacteria in the tank. Salt baths are another treatment option. A separate container is prepared with dechlorinated water and aquarium salt, into which the infected fish is placed for a short period, typically 5 to 10 minutes. This method can be effective in treating localized infections and reducing fungal load without medicating the entire tank. For isolated or mild infections, direct topical application of antifungal agents may be possible, especially when treating fish in a hospital tank. Using a cotton swab, the affected area can be gently dabbed with a diluted solution of the medication. However, this method is more stressful for the fish and should only be used if the fish is strong enough to handle handling. Removing organic debris from the tank is also vital during treatment. Fungi feed on decaying plant matter, uneaten food, and fish waste, so regular cleaning of the substrate and filter media helps eliminate fungal spores and reduce the chances of reinfection. Water changes during and after treatment are essential to maintaining clean conditions and removing excess medication from the environment once treatment is completed. Ultraviolet sterilizers can be employed as a preventive measure in aquariums prone to recurrent fungal infections. These devices use UV light to kill free-floating fungal spores and other pathogens in the water, improving overall water quality and reducing disease outbreaks. It is essential to remember that not all white patches on fish are fungal infections. Columnaris, a bacterial disease, can appear similar but requires different treatment. Misdiagnosis can lead to ineffective treatment and worsening of the condition. For this reason, a correct identification of the pathogen is critical before administering medication. Observation of the speed at which the infection spreads, changes in the fish's behavior, and other accompanying symptoms can aid in differentiation. Tank maintenance routines should be adjusted in response to a fungal outbreak. Increasing the frequency of water changes, reducing feeding to minimize waste, and avoiding any stressors during treatment can support the fish's recovery. Monitoring ammonia, nitrite, nitrate, and pH levels daily during the treatment period is advisable. Preventive maintenance after treatment should focus on maintaining a stable and clean environment. Incorporating live plants can help absorb excess nutrients and contribute to better water quality, though care must be taken to avoid plants that might rot and contribute to fungal growth. Adjusting lighting schedules and improving tank circulation are also useful in preventing stagnant areas where fungi can thrive. Tank mates that are prone to nipping or fin aggression should be observed closely or separated, as their behavior can lead to increased injuries and, subsequently, fungal infections. For breeders, fungal infections present a particular concern during the egg incubation phase. Fungus can spread rapidly among fish eggs, leading to entire batches being lost. Preventive antifungal treatments, such as methylene blue in spawning tanks, can be used to protect developing eggs from fungal colonization. Gentle aeration and water movement help prevent fungal growth on stationary eggs by increasing oxygenation and keeping spores from settling. Biosecurity measures in multi-tank setups are critical. Equipment such as nets, siphons, and algae scrapers should be designated for individual tanks to avoid cross-contamination. If shared, they must be sterilized between uses with appropriate disinfectants. Hand hygiene is also important. Aquarists should wash and dry their hands thoroughly before and after handling aquarium components, especially during treatment periods. Education and vigilance are key elements in preventing and managing fungal infections. Knowing the signs, understanding the conditions that favor fungal growth, and being prepared with the necessary supplies and medications enable quick and effective responses. Keeping a log of water parameters, changes in behavior, and treatments administered can help detect patterns and improve long-term tank health. It is also advisable to stay informed about new antifungal treatments and fish health innovations. Online forums, aquarium clubs, and scientific publications can provide valuable insights into disease management and product reviews. Building relationships with knowledgeable aquarium retailers or veterinarians who specialize in aquatic animals can also be an asset when dealing with stubborn or recurring infections. Finally, the emotional aspect of dealing with fish disease should not be overlooked. Many aquarists form bonds with their aquatic pets, and watching them suffer can be distressing. Proactive care, proper quarantine protocols, and consistent monitoring help reduce these occurrences, leading to a more fulfilling and enjoyable fish-keeping experience. Fungal infections, while common and potentially serious, are manageable with the right approach. Through a combination of sound aquarium practices, early detection, targeted treatment, and preventive measures, aquarists can effectively protect their fish and ensure a healthy aquatic environment that minimizes the risk of disease recurrence.